Hey, what's up, everybody? How you doing? My name is Fitz, and I am an acupuncture physician out of Miami, Florida. And I wanted to go over the AcuGraph system. The AcuGraph system is a tool that some acupuncturists like me, like myself, use, and it gives us an idea of the energetic balances in the human body, according to the TCM principle, traditional Chinese medicine, and according to so basically, you know, meridian theory. Okay, so again, the AcuGraph. So now let's break it down. Okay, Let let's break it down here. So now, if you see, these graphs have numbers, right? They have numbers, and number goes all the way up to 200. But if you look at these numbers right here in the blue, green, and red, you have your say 92, 106, 120. That's the limit for this patient. So anything above or below is going to consider an abnormality. Okay. For instance, the lung channel, which is red, is way above the the red line or the first line, and it's at 134 and 141. So I'm going to explain to you exactly what that means. And this is a good way to learn the AcuGraph system. It's a very great tool. Okay. So now, just so you know, also usually red means excess. Also, blue means deficient. Purple means there's a split, meaning that there's one side of the body that's higher than the other side. Okay. So it, if you break it down here, this is pretty cool here, chat. I said chat, but you know, it's pretty cool here. So again, the meridians show a significant excess in stagnation. So these meridians I'm gonna go over right now shows in excess and stagnation. Remember, because for instance, the LU channel, which is the lung channel, is above the maximum line for this patient, it's gonna be excess, and then that could mean like stagnation, or that can cause heat. So this is considered an extreme bilateral lung access. Okay, so what does that mean? So the lung is in charge of our immune system in Chinese medicine, the we, right? So it could be a possible acute invasion of wind heat or wind cold, leading to chi stagnation or chronic lung heat phlegm. All right. So symptoms could involve cough, asthma, chest tightness, or skin issues. Why? Because the lung channel also controls the skin in Chinese medicine. The right lung is at 141, and it is the highest reading on this chart. All right. Now, if you go over to the over here, you have the pericardium channel. Even though it's green, green is considered normal energy flow, but but you know, so so basically, the left side of the pericardium is is almost at the bottom of the baseline for this patient. But let's not go over that one. That was kind of okay. But let's talk about the heart channel. Okay, the heart channel. Now potential. Now the heart channel, the left side is way above the line. The reference frame is at 141. So what does that mean? That's potential for what we call blood fire or phlegm, disturbance of the heart affecting the shin, mind, and spirit. So this person can get insomnia from this, believe it or not, because in Chinese medicine, when the heart channel is on fire, it can disturb the shin. The shin is like the spirit, and then you could have it'd be hard for you to fall asleep or stay asleep. All right. So now if you go over here to the liver channel is deficient. As you can see, liver channel is clearly deficient. All right. So you will want to. So the liver in Chinese medicine is in charge of what we call the free flow of blood and qi, or free flow of the blood and qi. So if you have any deficient or stagnation, in the liver channel, that can cause you know it can cause what we call liver yang rising, which is heat that rises to the top, because stagnation can cause heat. It can cause your fingers and toes to get numb. It can cause your fingernails to get brittle because not enough blood is reaching the extremities. All right. So that's one way that you look at it. So overall for this, so so what's crazy about that? Significant deficient patterns, low priority for acute, but important for long term, right? So again, if you go back to the liver, you have bilateral liver deficiency. Bilateral, both of them are deficient, clearly, okay? Like I said before, the liver should be flowing smoothly. Deficiency can lead to liver stagnation, liver blood deficiency, often leading to spasm, dry eyes, difficulty planning, and being overtaxed and drained by the chronic stress. Stress involves the liver channel tremendously. Okay, this is particularly noticeable since the liver is what we call wood and should be controlled by excess fire. All right, and metal, but here appears to be drained. So the spleen channel, most of our spleen channels are going to be whacked because we eat, say crappy food. But so this screen channel, even though it falls within the reference frame, 1 to 6, 1 to 2 is still relatively high. Okay, so it could have issues with spleen deficiency, but so far it is okay. All right, so for the most part, the summary is, so the primary for this patient, the primary and the most urgent pattern is the dramatic excess in the upper jaw involving the lung. Right, the upper jaw basically is like your chest area. All right, so the lung, heart fire, and the pericardium. All right, so if you wanted to treat a patient, if I wanted to treat a patient like this, I will basically sedate and clear the upper jaw. Because the upper jaw has an excess, you want to sedate it. If it was deficiency, you want to tonify it. But if it's excess, you want to sedate it. Okay, you want to harmonize what we call the metal and fire elements. Okay, so again, without knowing the pulse and we also use the pulse and the tongue as part of the diagnosis. So without knowing the patient's tongue and tongue and pulse diagnosis, it's hard to make a complete full exam. But this is just an overview of how the AcuGraph system works. Like I said, this is a very, very efficient software that I use on my patients. And let me tell you, it's very detailed, and this will give us a good idea of what's going on internally, energetically in the body. Now, of course, you still need to get your regular checkups, X-rays, MRIs if needed. But this AcuGraph system gives us acupuncturists a tool that we can use to scan our patients and also recommend the best thing for them. All right. So hopefully I was clear. If you have any questions, leave it below, and then I'll see y'all later.